Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sada Floti, and this episode is everything you need to know about chronic pain and intimacy. But before I get into it, I just want to make one thing very clear, and that is I am not giving any type of medical advice. So if you're having issues with pain or pelvic pain or any of those things, please speak with your healthcare provider. And if you have any questions about your religion, please speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I am super excited to welcome onto the podcast Dr. Ruth Thornton. And Dr. Ruth comes to us from California. So Dr. Ruth, if you could introduce yourself to the listeners and viewers, that'd be great.
Sure. Thank you so much for having me. It's an honor to be here. Yeah, I'm Dr. Ruth Thornton. I am board certified in physical medicine rehab, or otherwise called physiatry, as well as in holistic and integrative medicine. As a physiatrist, I see a lot of different things, not just chronic pain, but I did start last year telehealth practice, health coaching practice, specifically for chronic pain. It's called Chronic Pain Rescue, because I do feel that population, it's a big population, and they don't have to suffer the way that they do. So, my goal is to help people go from chronic pain to pain-free.
That's fantastic. There are definitely a lot of people that suffer from chronic pain. So you are bringing so much value to these patients because, it's been very hard for them, I'm sure, to find practitioners that believe their pain, right? That's a lot of times we have that issue. And then those that are equipped to actually deal with that pain and then offer solutions that not necessarily are only medications, right? So that's fantastic that you do integrative medicine with it. So maybe you could tell us a little bit more about the types of pain that you see and that you deal with and how that affects intimacy.
Sure. Well, I know chronic pain is a big catch-all word. I mean, people have a generalized pain. Maybe it's a diabetic neuropathy pain. A lot of people suffer from neck pain or back pain. It may be what they call radicular pain, like a pinched nerve. The pain's traveling to the arm, the leg. So I do see those with arthritis pain. And of course, we know there's different types of arthritis, but it might be knee, shoulder, hands, feet, ankles, any joint, basically, hips. So I do treat all of it. I feel that even though, the specifics are different, there's certain mechanisms that are, or physiology that's the same, based on where chronic pain comes from. We know that chronic pain involves a hypersensitization of our nervous system, both peripheral and central nervous system, where there's chronic inflammation. And those factors that drive pain, things like heightened stress levels. Obviously, if you're in pain, it does cause stress. But the problem is it's sort of like your system's on a wheel. It's a broken system. So it continues to put out these factors, continue putting out these stress hormones. So people have difficulty sleeping. Their appetite is interfered with, and obviously their libido and their sex life is interfered with. So my goal is that, in addition, it's fine if they need procedures. It may be fine if they need medications, if they're not being abused, not harming them. But there are things that can be done holistically to help to decrease their stress level, decrease their inflammation, and help to get their bodies back in alignment with what it should be doing, so that any other interventions they do work better. So. Yeah. When you ask about sex, that's really not my department, I'll be honest, but I think it's important. I really do. And sometimes people come and will mention it. I find women don't mention it as much. And do you work with both men and women, or?
No. So as a gynecologist, I specifically work with women,
Right.
and, their issues. But I would imagine that, for anyone experiencing pain, especially chronic pain, that would really affect how they see themselves, their body image, and
Mhm.
can perhaps lead to depression. And we know
Yes.
that medications that are used for depression often will affect libido and sex drive, and also can affect arousal. And
Mhm.
so all of those things definitely can affect intimacy, physical intimacy specifically, but also if you're not feeling well or if you're feeling depressed, then that can also affect your emotional intimacy. So I can definitely see how chronic pain can affect relationships.
Right, right. And different people, couples can address it in different ways. Maybe a different positioning that it's going to be comfortable for the one suffering from chronic pain, so that they can enjoy and participate in that. Uh, Maybe just making sure they're, as before any activity, you take your pain pills to do that. And sometimes people just find other ways to pleasure with one another that maybe, you know, besides actual intercourse, there's other things that they can do that will sexually satisfy, even if it's not the actual act. If I'm making sense. So
Yes, absolutely. Absolutely. So, and you're absolutely right. So when patients have chronic pain and say somebody is experiencing back pain and things like that, they definitely want to experiment with different positions in the acts of physical intimacy, such that, their back pain isn't being aggravated every time or something like that.
right,
And like you're talking about, there's so many different aspects of intimacy that we can get into, and that I've also spoken about before. But specifically when you deal with patients that are having chronic pain and issues as such, what do you offer them in terms of, say, like your holistic practice or your integrative medicine practice?
right, right. I always start with the anti-inflammatory diet. I just think, you want to make your body as anti-inflammatory as possible. And that's not just what medications, that's also what foods you eat, what drinks you drink. A lot of people don't realize how inflammatory sugar is. It is a huge,
Mm,
it causes inflammation, and there's so much sugar in our diets, and high
wow.
fructose corn syrup, which they use in almost everything. You can read the boxes. Sometimes they only put corn syrup or syrup solids or something like that. It's high fructose corn syrup. It does not occur naturally in nature, and our bodies react to it with inflammation. It's our inflammatory process is part of our immune system process. So that, because it's not naturally occurring, it's going to trigger inflammation, and therefore you can have more pain. So I always start with that, an anti-inflammatory diet. Are you drinking enough water? A lot of people, most of us don't drink enough water. I know I have to work on drinking enough water.
Yeah.
Um, that helps decrease inflammation, that helps clear out the impurities and toxins in our body. So,
Sure.
it's important. Getting enough sleep is important. Exercise, even if all you can do maybe is stretching, because a lot of times people, their muscles are shortened because they're not moving. And with them being shortened, it hurts to move. And yet, that's what your body needs. It's what those joints need. So just, gently, kind of increasing their movement. Maybe if they have pain with walking, just try walking 5 minutes in your house, just as to get you started. So, hopefully bit by bit, you can tolerate doing more. So those are some basic things. Obviously,
Yeah.
decreasing stress, that might be my meditation. There's a lot of different things to help with that. So
Yeah. I think that's, so important what you just mentioned about an anti-inflammatory diet. I know you talked about decreasing sugar. What are other things that people could do to decrease inflammation in their bodies? I hear that people talk about milk, dairy.
right, right. Yeah, a lot of people, and they may not know it. You don't know it until you remove it from your diet and see, especially removing it for at least 21 days or so, get it really out of your system and reintroducing it to see how your body responds to it. But yeah, dairy is a common one, especially as people get older. We don't have the enzymes. Many people, as we're older, don't have the enzymes to break down the milk or the dairy products. And so it could be inflammatory for you. Also gluten. The wheat that we eat today is different from, 40 years ago, because in order to make it hardier to stand up against pests, etc., they genetically altered our wheat. So most of the wheat that we have doesn't occur again. It's been around, but it's not what's naturally occurring, and your body may be sensitive to it. We call them food sensitivities. So some people really, they can't eat gluten. They can't eat dairy, and just trying to have less processed foods is helpful. I know that people like hot dogs and things like that. Those are highly processed foods.
Sure.
So all the preservatives and everything, those are like, if you see a lot of words that you can't read, most likely you don't know how to pronounce that. Yeah, that's not a good sign and not a good thing to eat. Right. Of course, this is our diet. This is a standard American diet, which is sad. So I definitely recommend kind of being practical about it, being gradual about it. You're not going to probably change overnight, but you certainly, what you add is more, I think, more important than what you take away. For someone that doesn't eat vegetables, hardly ever eats fruit, add the fruit and vegetables. Whatever you still do, please eat these because they're going to help you. Yeah.
Right. And that makes sense, right? So if we know that inflammation is what's causing the chronic pain, if we try to take away things that cause inflammation, we're going to hopefully decrease that pain and that chronic pain, which
absolutely. And I've seen that. I've seen that happen a lot. Even people they just don't realize the things that we say are comfort foods, our donuts or, mac and cheese, whatever, they comfort us, but at the same time, they're actually making us worse. And when we remove those things from our diet, we actually feel better, So I've seen that with many, many people that, just that diet change, they feel better. Their body is able to heal and they have less pain.
Sure. So you had mentioned in terms of, what patients can do to decrease the inflammation in their diet. So you said about diet and exercise and things like that. What are the common ailments that you see? I know you mentioned back pain. Is there anything specifically with women that you see? Do you often see women that have a lot of like pelvic pain, chronic pelvic pain, endometriosis, any of those things? Do you see that in your practice?
I've seen them, but I have not seen them frequently. I have treated women with endometriosis in the past. Pelvic inflammatory disease that's there, but it's been some time. I have seen them though. Yeah.
Sure. And then have you noted that, once patients start to feel better with management of their chronic pain, that their relationships start to improve, they start to feel better? What is the transformation that your patients typically will see once they start incorporating these ideas and changes that you've suggested?
Oh yeah, they definitely feel better. Not only in terms of the fact that they have less pain, but they just have a better mood, better outlook on life. They're able to do more of the things that they like to do, and that makes them feel better. They're able to have a better self-image, as you were mentioning, just being able to beautify themselves, to look the way they want to look and also, feel that way as well. Those good feelings are important. They're important for your health, to be honest. So when they can have less pain, even if it's not totally pain-free, just having less pain and add, making themselves look the way they want to look, doing the things they like to do, it helps all around. It's an interesting thing. We are not just our bodies. We are not just our minds. We are not just our emotions. We're, as they say, we're spirit beings in a physical world. All of those things work together. And when we're ill, we should address the whole self. Just like when we're well, maintaining the wellness means not just maintaining our physical wellness, but our spiritual wellness, our emotional wellness, our mental wellness. So all those are important.
Right. So I know that sometimes, so as OBGYNs, we see something called vulvodynia and vestibulodynia, which is sometimes patients can have pain in their vulvar area and even at the opening of the vagina. And a lot of times, patients, that can be a result of, say, like a chronic infection or severe allergic reaction. And I know that oftentimes patients may ask for treatments for those type of things. I'm not sure if you see that, but oftentimes what we'll recommend is, of course, making sure that there's no infection, but also then sometimes they say that antidepressants and anti-seizure meds can also decrease pain going to the brain. And so I know that you talked a lot about chronic pain and how the nervous system is overstimulated. Mm-hmm. Do you ever use that? Do you ever use like antidepressants or anything like that to help patients who are experiencing chronic pain to help decrease those signals going to the brain?
Yes, I have. I definitely have. And certain ones, maybe if they're also having trouble sleep, some of them will help with the pain as well as help them sleep. So I kind of lean towards those if they're having trouble sleeping as well. The anti-seizure medications, I use a lot. I do use a lot. Now, obviously, it isn't about my coaching practice because unless they reside in California, I'm licensed to practice medicine in California, but I definitely can make recommendations. They can speak with their own doctor if they don't live in the state of California. But I use them. And then sometimes people will say, well, I tried that, but then the dose wasn't the accurate dose. And once we got them to the correct dose, they got the pain relief.
Right.
So I use them.
Yeah. No, that's
what about you with the vulvodynia that you're mentioning?
Right. So sometimes what we will recommend is topical anesthetic. So for example, lidocaine. So what they can do is they can dip a cotton ball in lidocaine. And of course, they would have to get that lidocaine probably prescribed from their physician, I would think. But so you can prescribe that and dip a cotton ball in, and then leave that cotton ball inside of the vagina, right at the opening, and to decrease penetrative pain that sometimes patients may have if they've had a history of chronic fungal infections that can cause the pain, and that can desensitize those pain receptors. Sometimes also patients can use capsaicin cream, which is, capsaicin is what gives like
cayenne pepper. Yeah.
Exactly. Exactly. So there's a cream, and you'd have to go to a compounding pharmacy to get this. And what you can do is you can also apply that cream to the opening of the vagina if that's where their pain is, and use that. And it usually takes a few weeks, but what that does is it decreases the receptors that cause pain. But what studies have shown is that once the cream is stopped, so if people are no longer applying the cream, then that pain can come back. And last resort is to actually have surgery on that part of the vestibule that's causing pain, and to have those nerve endings, part of that removed, so that those nerve endings are no longer there causing the pain.
Okay. I'm asking. You're asked. I'm supposed to be being asked, but I'm asking. What about those people with menopausal? Because
Yes, no, absolutely. So definitely. So what happens is that women that are menopausal typically have what we call genitourinary syndrome of menopause. So you get like that vaginal dryness, you get the vaginal atrophy, you get some of the you can even have shortening of the vagina that happens as a function of the decreased estrogen that happens with menopause. And so the way that we prevent those things, and you can have recurrent UTIs in menopause. And so the way that we prevent that is we ask patients to take vaginal estrogen. And what that'll do is it'll help to bring back that tissue, and that also it helps with the elasticity of the vagina. So not only would we recommend for women that are menopausal if they don't have intercourse, penetrative intercourse, then what we'd recommend is not only the vaginal estrogen to help with that tissue quality and the atrophy that they experience, but also women can use dilators to help stretch out that vagina, to increase that elasticity also in that vagina. So yes, absolutely for women. And that is a very common cause of pain in women that are premenopausal and postmenopausal because of the decreased estrogen and the decreased lubrication. And if somebody, for whatever reason, really there are very few contraindications to vaginal estrogen. And in fact, I've heard somebody say, a history of cancer, but I mean, most, and I'm actually studying for to become a menopause practitioner, but I don't remember any offhand contraindications to taking vaginal estrogen because it's localized and it's not systemic, so it's not going throughout the whole body. Right. And it is helping that tissue right there in that place. And it's so important for women to use vaginal estrogen to prevent all of like the loss of the rugae, the loss of that elasticity, the thinning of that tissue of the vagina. So all of those things can be prevented with vaginal estrogen. And it's so important, really, even to start during perimenopause.
And what about the women that are sexually active and have those symptoms? Because I think they probably don't want to use the vaginal estrogen, or at least maybe, I don't know if they time it differently.
Yeah. Yep. So what you can do is the vaginal estrogen is applied, and it's usually 1 gram. And so it's like really about the amount of just like your index finger. And you can use the cream, or there are tablets, or there's actually a ring called Vagifem. So it doesn't have to be messy if you don't want it to be that cream that gets all over. You can use, there are different forms of vaginal estrogen that are, definitely women can use, and that are user-friendly if that's something that you're worried about. But I would absolutely recommend vaginal estrogen to anyone over the age of 45. I mean, it helps significantly, and with the vaginal dryness. And if women, for some reason, don't want to use that vaginal estrogen, you can definitely use a moisturizer. There are vaginal moisturizers that, again, help with lubrication, and they're meant to be used 2 to 3 times a week. And again, it'll help with the lubrication. You can use a lubricant, but lubricants are very temporary. They're used during intercourse. They're not for long-term use. They don't really do anything for the tissue quality. Right. Whereas like a moisturizer will help with the tissue quality. But the best thing really is vaginal estrogen. That really. And
they would have to see an OBGYN or someone of that nature
somebody that can prescribe the vaginal estrogen. Yeah. I mean, it doesn't have to be an OBGYN. It could be any provider that's willing to, give them. And really, I don't see why any provider would hold back on giving vaginal estrogen to women, especially because, it's so needed as women approach midlife and beyond. Yeah. So really important for them. And it helps with, the pain and the pain that they may have with the intercourse.
Right. And what is your opinion on the bioidentical estrogens?
Yeah, absolutely. So, what we say, according to the American College of OBGYNs, they don't really recommend bioidenticals because bioidenticals, there's no FDA regulation, and we don't know the amount of estrogen or say progesterone that are in the creams or usually bioidenticals, they're typically creams or, something that you can rub on and things like that. Or they can be oral tablets, I guess, as well. But we just don't know because they're not FDA regulated, and we don't have like trials and research on those that are done. And so that's why the American College of OBGYNs typically does not recommend bioidentical hormones that we don't have data on. There are, we do have micronized progesterone, which is a bioidentical, and we do have estradiol tablets that you can take that are bioidenticals that are FDA regulated. And also there is the patch, estrogen patch, which is the a safety profile on the patch is even better than the oral tablet. And so because you don't have that first pass effect that goes through the liver. And so the estrogen patch is even better. So if women have an IUD, so, women that we know that have a uterus they can't just take estrogen by themselves. They can't have unopposed estrogen. They always need to have a progesterone if they have a uterus. And so if they have, say, for example, a Mirena IUD or an IUD that contains progesterone, then all they need is the estrogen patch, and then you're covered. So you have something that protects the uterus, and you have the estrogen for all the other benefits. And estrogen helps with everything. It helps because we have estrogen receptors throughout our whole body. We have estrogen receptors, for our hair and our skin and in our brain. And so, a lot of women, there's often jokes made that, that, oh, I forgot what I was going to do and things like that. Right. And that's true because women will get that brain fog in perimenopause and in menopause. And so the estrogen actually helps prevent that. And it makes a significant difference. So, I'm a complete advocate for hormone therapy for women because I think that the benefits, outweigh the risks. And what happened, I think, is that in 2002, when the WHI study came out, telling us about, what they felt were the risks of hormone therapy, there was a whole generation of OBGYNs that then felt very scared, including myself, to give out hormone therapy to women because we didn't want to cause any problems, right? We didn't want to induce like stroke or blood clots or anything like that, and or breast cancer, right? That was always the fear, that you don't want to give hormone therapy because, patient might get breast cancer. And now we know that those results were taken out of context and that actually hormone therapy, and so the North American Menopause Society, which I believe now has changed their name to Menopause Society, completely says that, hormones are safe, and especially within the first 10 years of menopause. They suggest, and now, there's some thought that maybe they don't even say to do it for the shortest amount of time. But in my readings, what I found is that they do say to use the lowest dose for the shortest amount of time, but that women can take hormones and that it's safe, and that, if they need it, they should have it. So really important.
Okay, that's good to know. Thank you. Okay, I don't know if you have any more questions for me.
So, I'm curious to find out in terms of like the transformations that patients get when they work with you, do you find that their relationships have improved, that their mood has improved, and what are the biggest changes that patients find once their pain has been managed, if not completely relieved?
Right. Well, like I said, they're just happy to be able to do the things that they weren't able to do, even if it's something mundane, like taking care of their home, being able to take care of their kids, having the energy to spend time with their spouse, spend time going and doing things with their family. So yeah, they definitely have a better outlook on life, getting their lives back, really.
Absolutely.
Getting their lives back. Yeah.
It's fantastic. So, well, for anyone listening and somebody that's thinking that, they are experiencing chronic pain and would like a more holistic and integrative approach to management of their chronic pain, how can patients or clients find you, and where can they reach out to you and get help?
Sure. Anyone that is interested in working with me, or someone that should work with me, my website is Chronic Pain Rescue, www.chronicpainrescue.com. I'm also on Facebook at Chronic Pain Rescue, Instagram, YouTube, Pinterest, because I post information that I hope people can use. They can sign up on my website for schedule an online appointment. I'll see you in your home. And I also, if you're not sure you're ready to, work with me, but you're interested in learning if I would be someone that could help you, I have 3 free 30-minute phone consultations that they also can go on social media to sign up for.
Well, that is fantastic. So many great ways to work with you. Well, thank you so much, Dr. Thornton. And well, I am done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So if you are suffering from chronic pain, please speak with your healthcare provider. And until next time, this is the Muslim Sex Podcast.